Hi everybody! Today in my video we're going to be talking about Haglund syndrome, which is an injury of the ankle. It's a combination of Achilles tendonitis and retrocalcaneal bursitis. So the Achilles tendon is the soft tissue that attaches the calf muscle to the calcaneus, and the tendon right there gets inflamed and irritated in the insertion point. And the retrocalcaneal bursa sits right in between the Achilles tendon and the calcaneus. It's sometimes called the Achilles bursa as well. So that bursa can get inflamed and irritated as well. This is a classic overuse injury. It occurs with sports that have a lot of running and jumping involved, or any type of repetitive motion of the ankle. And it also occurs because people increase their level of exercise, their intensities, their durations too quickly. So they go from not exercising enough to exercising too much, and that really irritates that bursa and that tendon. People who are more likely to develop this are usually overweight, they have tight calf muscles, they can also have flat feet, and men are more likely to have this as well. Weekend warriors are also another group that is more likely to develop Haglund syndrome. Those are people who are sedentary for most of the time, and then they have a couple days where they're incredibly active. And then as you age, your tendons and your bursa and all your soft tissue become weaker and more sensitive, so usually it's older people who develop this. Some history questions you can ask your athlete if you are thinking that they have something like Haglund syndrome or another similar overuse injury. You can ask them about their training schedule, what their intensity is like, what their frequency is like, how long they're training for, how long have they been maintaining this training schedule. Those are all good questions just to kind of gauge if they could have an overuse injury. You can also ask them about the type of shoes they wear. If they're wearing old, worn out shoes, it's more likely to irritate those soft tissues and cause problems. You can ask them how long they've been wearing them, how well they fit, if the shoes are rubbing in any places that they shouldn't be, what kind of shoes they wear when they're not active. Women who wear high heels frequently, that can also cause some problems in their calf muscles and in their Achilles tendon and that bursa. Some observations to look for while you're assessing your athlete: there'll be a lot of pain in that heel area up their Achilles tendon. Usually it will subside with increased exercise, so as they warm up it'll hurt less, but when they're just getting started there's going to be a lot of pain in that area. It'll also be tender to touch, especially on that Achilles tendon right in there and on that insertion area right on the calcaneus. They'll have a lot of stiffness in their joint as well, with some limited range of motion usually, and dorsiflexion. And they can occasionally develop Haglund's deformity, which is calcification that occurs if these injuries are left untreated. Calcification can occur on their calcaneus right here, and it'll often cause a protrusion on their heel that looks like this. And it's important to note that that deformity is not always present when they have Haglund syndrome, so it's important to make sure that you're looking for those other red flags and risk factors as well. So some important palpations to make sure you get to in your evaluation is the calcaneus, the Achilles tendon, and the surrounding area of the Achilles tendon. So the calcaneus, we're going to want to start on the bottom of the foot and just palpate all the way to the back of the heel. And when you palpate this, the bottom of the foot shouldn't feel any pain, but as you palpate on the back, they should start feeling pain, especially when you get to the insertion point of that Achilles tendon right there. And then as you palpate up the Achilles tendon, that will also be painful. And when you palpate along sides of the Achilles tendon, we're trying to feel that retrocalcaneal bursa in there, so that will be sensitive as well. And sometimes you'll also feel like a spongy feeling as you are palpating in there. So those are palpations that you want to do along with the palpations that you would regularly do for the ankle. And we're also going to test range of motion, so we're going to take them through active and passively. So we're going to have them go into dorsiflexion, into plantar flexion, into eversion, keeping their knee still, and inversion, keeping their knee still. And their range of motion should be okay except for their dorsiflexion, because that is going to stretch out that Achilles tendon and it's going to put a lot of pressure on that bursa back there. So it's going, it can be painful when they're doing that actively and passively, just that stretch on the Achilles tendon. And some special tests that we want to note while we are doing our evaluation. The first one we're going to do is the Thompson test. So we're going to have our athlete lay on their stomach, and we'll do it on this front foot right here. So what we're going to do is we're going to squeeze their calf muscle right in here in a couple different spots, and as I squeeze you can see that her heel or her toes are moving when I squeeze it, and that's just indicating that there's no ruptures in that Achilles tendon. We want to make sure that that is intact, so we know that there's not a bigger problem we're dealing with besides just an overuse injury. So the next one, if you want to flip back over, that can have pain with it is the bump test. And this doesn't mean that there are fractures along with their Haglund syndrome. It just depends on where the point of impact is that can cause some pain. So if you're going right on the bottom of their heel, right there, they can feel some pain up in that Achilles tendon insertion point, but if you're going right on the bottom of the heel, they shouldn't feel as much pain. So that doesn't necessarily indicate anything, it just might have a positive test depending on how the test is administered. Some treatments that we can do for an athlete that has Haglund syndrome. We're going to want to start with, as with every injury, we're going to want to start with price. So we're going to have our athlete protect their ankle, they're going to rest, we're going to ice it, compress it, and elevate it. So something that's really great for all of those is Game Ready. We can use the small sleeve or we can use the boot if the calf is affected higher up. It just depends on how much pain they're feeling and how high it goes, for which boot would work better. But those are both really great options. As always, we want to make sure athletes' injury is elevated above their heart, so using the wedge and a bolster is always a great option. And another thing we can do while, if you just want to lift up your feet a little bit, while we are doing the treatment and their acute stages to decrease or to maintain compression even while they're not in the treatment room getting game ready, we could do an ACE wrap. So we're going to start at their toes just like we would for an ankle sprain with a good amount of tension on that ACE wrap, and we're just going to do spiral up their ankle, making sure that there's no spots left open for the swelling to pool. We'll go all the way up for that. And this is something that the athlete can do on their own, as well as something we can do in the treatment room for them. And this is just going to help keep that inflammation down in their Achilles tendon area. So we'll just close that off. Okay. And something that might help them is taking something like ibuprofen to help with the pain and the swelling, or if we just want to help maintain their pain level, they can take Tylenol so that the inflammatory process isn't affected. If their pain level is high enough, a doctor might prescribe them to have corticosteroid injections in their Achilles tendon area just to help with that pain and decrease some of that inflammation as well. And we can also do light therapy on their Achilles tendon and then their calcaneus and on that bursa to help stimulate that mitochondria to produce ATP. That'll help the healing process as well. After they're out of their acute phases, so with the chronic injury like Haglund syndrome, it's difficult to know when they've progressed from acute to chronic, but if they don't have any redness or any heat coming off of their injury, we can go ahead and move them into some heat therapy. So we can do ultrasound just to release the tension in that area and increase blood flow. And we can also do some stretches and some exercises. And before we begin those, we're always going to want to start with a warm-up. So we'll put a hot pack on the calf for about 10 to 15 minutes. And then we'll move on into some light stretching. So the first thing we're going to have our athlete do is towel stretches. And we're just going to put the towel underneath their foot, and they're going to hold it. And they're going to stretch their calf. They're going to put their foot into dorsiflexion with the towel, and they're going to stretch their calf to their tolerance. And because they will have some limited range of motion, we want to make sure that we stress that they do this to their pain tolerance, because we don't want to put any pressure on that bursa and the Achilles tendon that's going to be too much. So they can do that for 15 to 30 seconds at a time, and we can repeat that maybe 3 or 4 times. And then we will move on to the tilt board right here. So we'll have our athletes stand with both feet on the incline, and we'll have them begin with straight legs, and again we'll do this for 15 to 30 seconds. And then we'll have them bend their knees for 15 to 30 seconds again, and they can repeat those again 3 to 4 times, just depending on how much pain they're feeling. We always want to make sure that we're exercising them within their pain tolerance. So if our athlete has had any decrease in their range of motion, we can move over to the tilt board to help them with their dorsi and plantar flexion, and it'll also help increase their strength in their calf and the muscles on the anterior portion of their leg. And we want to make sure that they're tilting back and forth slowly and controlled. And when we do this, we might want to do it that we touch our toes to the ground 10 times, and our heels to the ground 10 times, or we can do it for a set amount of time, like 30 seconds. It just depends on how the athlete is feeling and how much fatigue this is giving them. And after we're done with that, we're going to move to the balance pad, and this will help our athlete's proprioception in their ankle if the time that they've taken off to rest has decreased that any, or if the swelling has decreased their range of motion at all. So we'll have them begin by standing on one foot and working on their balance. Again, we're going to want to make sure that they're keeping their posture good, so their shoulders are back and their chin is up. And after this has become too easy, we can start playing catch with them as they're doing that, just to increase their difficulty level and increasing that gain in proprioception. And we'll do all of these stretches and exercises with both feet so that there's not a deficit in their strength or range of motion. And one more exercise we can do, we'll take a towel and we're just going to put it on the floor, and our athlete is going to scrunch the towel up with their toes and then pick it up off the floor. So, yep, and then pick it up. And then once they've done that, they'll smooth it back out, and we're going to repeat this about 10 times. Or again, if that is too much and it's fatiguing too quickly, we'll decrease that, so we can go 7 times or even 5 times, just depending on the preference of the athlete. So it's important to treat the root of this problem. So one of the things that could be causing Haglund syndrome is poor equipment. So if their shoes are worn out and old, they've been wearing them for a long time or working out in them frequently for a good amount of time, we're going to want to advise them to maybe look into buying a new pair of shoes, or we can see how their shoes are fitting them. They might need to buy new insoles or some kind of orthotic just to help the fit a little better. And it's important that we treat the underlying issue of the cause before we get too far in their rehab. And then when we have them returning to play, we're going to want to make sure that they are not returning to play too quickly, because this injury is often caused by increasing our activity level too quickly. So something we can do is have them walk for 4 or 5 minutes, and then they're just going to take a 2-minute jog. And then they're going to repeat that maybe 3 or 4 times. And then a couple days later, maybe have a day of rest in between. And then the next day, they're going to increase the amount of time that they're jogging to 3 or 4 minutes, and they'll repeat that 3 or 4 times again. And we're just going to cycle through that until their fitness level is high enough that they can run or jump without any pain. And it's important that we teach our athlete about having a good warm-up before they start getting into their activity, so they can have a good jog. They can come in and get some heat on it. We can even do a massage to help get that blood flow into the area and we just want to make sure that they're stretching really well and warming up before they get too far into their exercises. The best way to treat Haglund syndrome is to prevent it. So some things that we can advise our athlete to do to prevent it from setting in is keeping good form while they're exercising. That's really important. It's also important that they're maintaining the strength and flexibility in their calves and ankles, and they also need to warm up before they play or practice to make sure that they don't have any issues with soft tissue damage, stuff like that. And they also need to be wearing the correct shoes for their activity that fit properly. We want to make sure that there's no pinching or it's not too tight on the back of their heel, which can aggravate that Achilles tendon and that bursa. And also if they have proper arch support, that'll also be a help. And we want to make sure that they are progressing properly so that they're not increasing their activity level too quickly. We want to make sure that they're on a good training schedule. And it's also helpful if they cross-train so that they are building different muscles in different ways as they are exercising.